everyone. I understand that this day is potentially slightly difficult for you today. But having that in mind, today's lecture is not going to be longer than 17 slides, and we will be speaking about a very interesting aspect of our sensory system, and that entails the vestibular apparatus and what we call balance. Now, when it comes to balance, we have mainly two components, and these are being governed by the vestibular apparatus. So these two components that we're talking about, we have the tonic component and we have the dynamic component. So the tonic component entails mainly the otolith organs, and these otolith organs are named sacula and utricle, whereas the semicircular canals entail the dynamic component of the vestibular apparatus. And what exactly do we mean by that? So when we say tonic component of the vestibular apparatus, we're talking about an aspect of our balance system that mainly has to do with the position of the head when the body is static. Now, compared to the semicircular canals, which they make up the dynamic component, as we said, these mainly tell us information in regards to the rotation of the body. So, as you can imagine, and as their name implies, dynamic has a more vicious element compared to the tonic component. Now, let's go and see what we have today. So, as we said, the semicircular canals, they govern the dynamic component that governs the movement of the body in space. And by saying that, we're talking about somersaults, we're talking about a variety of movements that the body can do in space. Now, the static component mainly tells us about where our head is positioned in space and time. Now, all this sense of equilibrium that we perceive in our body comes from very small hair cells that are embedded either in the saculae maculae or the semicircular canals, particularly the ampulla. Now, all this information they travel from the vestibular system to the vestibulocochlear nerve, and they reach the cerebellum without synapsing, and also the medulla, from where the medulla projects to the reticular system as well as other higher cortical structures for the orientation of the eyes in space and time. Now, compared to what we've covered yesterday, the vestibular apparatus has some common components with the auditory system. First and foremost, both of the sensory information that we perceive from both systems, they come from modified neuronal hair cells called kinocilia. In any case, though, compared to the auditory system, the balance system of our ears consists and it is governed mainly by gravitational forces, not by the interpretations of sound waves as they travel and they displace water molecules in the cochlear duct. So over here, we have a beautiful diagram of what the vestibular apparatus consists of. So over here, we have the utricle and the sacula, which they are responsible for the tonic component, as we said, the position of our head in space and time. And we also have the semicircular canals that tell us how the body is rotating in space. So one major similarity with the cochlear duct of the vestibular apparatus is the fact that both of them communicate and they're also bathed in endolymph. Thus, as you can imagine, in order for them to transmit their information to the vestibulocochlear nerve, they enable potassium channel pumps for the activation of the action potentials. So compared to any other part of our body in which we have in its majority the utilization of sodium, the semicircular canals, they mainly employ potassium communication. However, that we have an additional accumulation of endolymph in the vestibulocochlear duct, not only the patient will be perceiving a buzzing noise, but in addition to this, we could also have displacement of certain vital elements of the utricle and the sacula called otoliths in the semicircular canal, eventually giving the sense of vertigo, which we'll see later on. So now let's look at the two systems separately, the static component and the dynamic component. So the static component is mainly being governed by certain otolithic organs that are situated in the macula. And these otolithic organs are modified some say that respond to gravitational forces. So if the head tilts backwards, forwards, left, or right, then these otoliths that you see over here in your slide where the head is, they're gonna tilt the direction of the head, and then through the neuronal activation, the cerebellum will be informed in regards to where the head is in space and time. Now, in addition to this, one of their main responsibility, due to the fact that they're being placed in a vertical position in your ears, they can sense direction in a variety of ways. First of all, the utricle can sense linear acceleration of the body. So let's say if the body is going to move forward or backward or left or right, then this, along with the sacula, will inform where the body is moving in space and time. Because again, gravity is the main component of neuronal transmission. Now, there are also a variety of ways that these otoliths could be responding. So if we assume that the body is starting in time, then if let's say the body is tilted and it starts rotating in a specific plane, then again the otoliths are going to start moving and inform us of where or more or less where our body is in space. Bearing in mind that the main focal interest of the otolith is where the head is in space, not the body, which is part of the semicircular canals. So the semicircular canals are slightly more complex than the otoliths. So although the otoliths are a fantastic servo mechanism of the body, we would also need the semicircular canals to tell us where exactly is our body in space and time. And they work in addition to the sacula and macula exactly where is the head and exactly where is the body in space and time. So we have the posterior semicircular canal that is going to tell us if the head is in the left or the right position. We have the superior canal, which is important when it comes to nodding. And we also have the horizontal canal when we're talking about moving the head towards the upright position and saying no. Now, you might be wondering, why exactly do I have two organs more or less doing the same thing? Why would I have the otoliths as well as the crista in the cupula doing the same thing? Now, the otoliths are very sensitive organs, and they facilitate mainly micro movements of the head. This is why we have an enhanced perception of where our head is in space and time. However, the semicircular canals, they facilitate a more vicious movement of the body. This is why over here you see an Olympic athlete performing what we call a somersault. And how exactly is this rotation of the body sensed by the semicircular canals? Inside the semicircular canals, we have certain enlarged chambers or the enlarged components. And these enlarged components, they contain the ampulla. The ampulla contains the organ of crista, which is a sensory organ that is made up of a gelatinous, okay, called the cupula, as well as hair cells that sense how the cupula is behaving based on the position of our body. So, assuming that the bony skull is static, then, and bearing in mind that these semicircular canals, they entail fluid, then as the head moves in space, then the water that is inside cannot keep up because of the inertia. So imagine that we have a static component, okay? So let's say this is your semicircular canal. Now, if I move left and right, then the water is gonna move to the opposite direction of where I'm moving, okay? So if I move to the left, water is gonna go to the right. This is exactly what happens and what the cupula senses. So you might have to imagine that these forces, as the direction of the head is moving towards the right, then the endolymph, which is the water part, is gonna move to the left. Eventually, we know exactly and in detail where is our body is situated in space and time. Now, as soon as these specialized hair receptors are activated, and also when the otoliths displays the gelatinous otolithic membrane, then the information of that activation travels all the way from the vestibulocochlear nerve to the cerebellum without synapsin, and also travels with and also synapses to the vestibular nuclei of the medulla. Later on, it projects to the reticular formation that mainly governs somatic neurons controlling eye movement. So, if you're moving rapidly throughout space and time, then the semicircular canals and the otolithic organs are the ones that will be responsible for the correct positioning of your eyes in space. Now, let's look at the following case. Anand reports to the otolaryngologist that he never knows when his attacks of dizziness will strike and that they last from 10 minutes to an hour. They often cause him to vomit. He also reports that his persistent low buzzing sound in one ear and that he does not seem to hear low tones as well as he could before the attack started. The buzzing sound often gets worse during his dizzy attacks. Now, this ringing sound that the patient is feeling, obviously, it comes from what we've learned yesterday from the cochlear duct that contains the organ of corti. Now, bearing in mind this, without knowing that the individual has vertigo, it could be the occasion, let's say, if we didn't have if we did not know that the individual has vertigo, we could assume that the ringing sound that the individual hears in his ears could either come from conductive reasons or sensory neural. And what do I mean by conductive? So it could come from, let's say, an enlargement of the small bones inside the inner ear, such as the stapes, the incus, and the malleus. On the other hand, it could also come, and this is the right answer over here, from excessive fluid accumulation in the inner ear, affecting the hair cells in the cochlear duct. Now, this is particularly important over here because, as you can recall from your lecture yesterday, we have the tectorial membrane adjacent to the organ of corti that contains the modified hair cells for the perception of sound. If fluid accumulation in the cochlear duct is to such a level that it cannot be drained, then the tectorial membrane could move and crush the kinocilia of the organ of Corti, eventually leading to deafness. Now, on the other hand, we do know that the cochlear duct, along with the vestibular apparatus, they communicate. They communicate and they both share what we call the endolem. The reason why this individual is facing transient attacks of dizziness is due to the fact of the displacements of otoliths by the utricle and saculae, which they're freely floating in the semicircular canal, displacing occasionally the cupula that contains that gelatinous mass that senses the rotation of the body, giving the sense of vertigo. Now, there are a variety of ways of treating this phenomenon. The least invasive is limiting salt intake by the individual. On the other hand, if the symptoms continue, then the ENT surgeon could continue to sever the vestibular nerve, eventually alleviating Meniere's disease. However, a variety of side effects could occur in this occasion, including loss of hearing. Now, the next two slides involve the examination of the integrity of the vestibular apparatus. And one way of doing so, there are two tests, the Barani test and the caloric test. The Barani test involves the rotation of the individual in a specific chair, in which the ENT observes the movement of the eyes while the body is rotating in space. So as the body is moving, the eyes will move in the opposite direction, okay, to give the individual a sense of balance. However, as soon as the eyes reach to a specific point in which they cannot reach the rotational movement, then they start moving in the same direction as the rotation, so that they start to fixate a point in space, so that the individual retains their sense of balance. If that rotation stops abruptly, then the eyes will move in the opposite direction. And eventually also the individual might lose their sense of balance. This is called post-rotary ristagnance. So what you should remember in this test is that as soon as the rotation starts happening, then we have opposite direction of the eyes. As soon as the threshold is reached and the rotation still continues, then the eyes move in the same direction as the rotation. And as soon as this rotation abruptly stops, then we have again, like the beginning, the opposite direction of the eyes. And for those of you that do not know what nystagmus is the involuntary jumping of the eyes in space so that it can manage to fixate a point in time so that the individual can retain their balance. Now, the caloric test is something quite fascinating because while we perform the caloric test, we see something quite peculiar going on. And the reason why we see this phenomenon is because the endolymph in the semicircular canals behaves in a specific way. If the fluid goes into a molecular constriction, or if the membrane, let's say, goes into a molecular constriction, then the cupula will bend towards the side of the semicircular canal. Eventually, as the nerve communicates with the reticular formation, it's gonna tilt towards the direction of where the cold water is being inserted. In the occasion that we insert warm water because of the enlargement of the membrane, then the cupula is gonna tilt in the opposite direction. Eventually, the eyes will also gonna turn to the other direction from where the water has been inserted, the warm water. This phenomenon could last up to 2 minutes. So these are the main two tests for you to check the integrity of the vestibular system. And I will take any questions that you might currently have. Okay, let's start from the beginning. Can you explain this slide? Which slide are you referring to? This is a slide, I presume, right? Okay, so over here, my dear, we have the activation of specific nerves, of specific kinocilia in the vestibular apparatus, and this they're gonna communicate with the vestibulocochlear nerve, which they're gonna send direct impulses to the cerebellum. So you can imagine that there is a connecting fiber between the vestibulocochlear nerve and the cerebellum. Whereas when it comes to the vestibular nuclei of the medulla, we have synapses going on between the vestibular nerve as well as the medulla. So let's say in one occasion we have interrupted synapses, and in another occasion we have uninterrupted. Now, if you want me to explain this further, the reason why it travels to the thalamus and then to the cerebral cortex is because from one point of view, we also have the involvement of the eyes, and from another point of view, the vestibular system also senses part of, let's say, if the body will fall. Let's say if we're walking, we stumble on an object, then we also would lead in putting our hands in front of our face. So that's also one of the reasons why we have projections from the reticular formation to the thalamus and the rest of the cerebral cortex, because we also engage not only the motor part of the eyes, but we also engage the motor part of any other part of our body. That could include the legs, the hands, and anything else that has to do with movement. So, Meniere's disease, and I believe you're talking about benign paroxysmal vertigo, they share a common component. The common component that they share is the fact that we have displacement of otoliths from the sacula and macula, that they're circulating freely in the semicircular canals. However, the difference between the two, and as you will read in your slide that I've put in the blue slide, one is coming with tinnitus, and that's Meniere's, whereas the paroxysmal vertigo usually is not accompanied with a ringing sound. Okay, the other one, the Barani test. Now, the Barani test, the abnormal finding would be that the eyes would not move in the following manner: opposite, same, opposite. So it could be, it will be same, opposite, same. So you would see exactly the contrary of what you're seeing in this slide. So that's what you would see in an abnormal barony test. Okay, I believe that this sums up our lecture for today. I hope that you've enjoyed it, and I'm sure that you're also gonna do a great job when it comes to the exam. Again, happy Ramadan, everyone, and I'll see you again next week.